Management OPM will be giving information on an emergency situation affecting the island. Please be on the alert and listen to your radio and television for further information. This was a test of the emergency alert system, brought to you by OPM.
Heavenly Father, we come to you this hour asking for your blessings and for your help as we are gathered together to discuss matters of grave importance. We thank you for each mind and heart that fills the presence of this virtual room. We ask for your healing hand on our country, Jamaica, as well as our adopted homeland, the United States of America. Lord, may your will be done through this event. We ask also that you be the guiding light for all we set out to accomplish this evening. In Jesus' name we pray. Amen.
Amen.
Back to you, Ambassador Marks.
All right. Thank you, Ms. Taylor. Let me go straight into the overview from Ms. Let me also, before that, recognize our consul from Philadelphia, Mr. Christopher Chaplin. Good to see you, Mr. Chaplin.
Good evening, Ambassador.
Yes. Let me go straight to Ms. Kimberly McLeod and ask her for the OPM update.
Good evening. Thank you, Ambassador, and good evening to everyone who joined us this evening for the Let's Connect with the Ambassador, which I think is such a wonderful, wonderful program. I want to begin first with our curfew hours, which of course would have been as at the 18th of September through the updates given to Parliament by the Prime Minister. And our curfew hours are Mondays to Fridays, from 8 p.m. nightly to 5 a.m. the following morning. And of course, on Saturdays, the curfew begins at 6 p.m. in the evening until 5 a.m. on Monday morning. That is to say that Sunday is a no movement day. And so again, the curfew hours for weekdays, Mondays to Fridays, 8 p.m. to 5 a.m. Saturdays, 5 a.m. or rather 6 p.m. to 5 a.m. on Monday morning, which means that Sunday is a no movement day. And the no movement day Sundays and these measures will continue in place until October 28th, when the Prime Minister will give another update in respect of the new measures, or what we would call the recrafted COVID containment measures. The gathering limits remains at 10 persons. Places of worship, 20 persons. And I want to at this point note that there was an amendment to the gathering for places of worship, seeing as Sunday was a no movement day. You perhaps would have heard, because I know the diaspora is very much in touch with what is happening in Jamaica. So you would have noted that our churches or Sunday worshipers had some challenges with Sunday being designated a no movement day. And so the Prime Minister met with the Jamaica Umbrella Group of Churches, and an amendment was agreed that would see Sunday worshipers being able to have the same opportunities as those who worship on Saturdays. And so I want to read the press release that the Prime Minister issued in respect of church on Sundays. So the Prime Minister says, in recognition of the importance of allowing in-person and not only virtual worship for both Adventist and Saturday worshipers, as well as Sunday worshipers, effective Saturday, September 25, so that was last Saturday, the number of persons, including clergy and support personnel who may be physically present at any time at a place of worship, will be no more than 20 persons, or where more than 20 persons can be accommodated at the place of worship while maintaining the physical distancing requirement of a minimum of 6 feet between persons, no more than 50 persons. So generally, the gathering for church is 20. However, if the church is large enough to accommodate persons maintaining the 6 feet distance requirement, the limit is 50 persons. So even if it's a church that could normally accommodate 300 persons, the limit, the maximum you can have is 50. And this, of course, does not take away from Sunday being a no movement day.
About 100 people.
I'm sorry?
No, please continue.
Okay. All right. So this is, again, I was saying that this does not take away from Sunday being designated a no movement day. And persons moving for the purposes of worship on Sundays will, of course, need the required document, which is attached to the latest DRMA measures, which can be found on the Office of the Prime Minister's website under the press room tab and also titled DRMA. Now, I was noting also that the gathering limit is 20, and this applies for weddings, it applies for annual general meetings, and it also notes that no physical attendance is allowed at any event hosted by a public entity. Only virtual events are permitted. Now, as it relates to work from home, the Prime Minister in the early stages of the pandemic indicated that at the discretion of our permanent secretaries, where employees, especially within the public sector, and of course at the discretion of employers within the private sector, where employees can work or can perform their tasks remotely, they should be allowed to do so. What I can say though is that within the government service, or certainly at OPM, what we have done for the most part is that we, and this is not across the board, it is subject also to the department head in agreement with the permanent secretary to allow for 3 days in and 2 days out. And that has worked. And of course, that changes from week to week. For funerals and burials, the number of persons allowed at funerals has moved to 20. We remember then at a time when funerals were not permitted, but burials were. So the number of persons allowed at funerals is 20 now within the church. However, the number of persons allowed at the burial site is 15 to include the mourners and the undertakers. Burials, of course, are limited to Mondays to Fridays, rather, between the hours of 9 a.m. to 4 p.m. And again, only 15 persons might be present at burials. Now I think I covered places of worship, burials, funerals, gathering limit. The other thing I'd like to mention are public beaches. Those under management are allowed to open between the hours of 6 a.m. and 4 p.m. And that is under management. So if it is not under management, it cannot be open because management will be responsible for ensuring that the COVID protocols or the COVID containment protocols are observed. So I think if there are no other, and I think I did mention the no movement days being Sunday, and this of course continues all the way up until the 28th. The controlled re-entry protocols remain as they were agreed from March. And we of course appreciate that the vaccinated persons are allowed to quarantine for 8 days. Once they come in, if you're unvaccinated, you must quarantine for 14 days. However, fortunately, if you are vaccinated and you wish to be released from the quarantine of 8 days, you may go ahead and pay for a COVID-19 test at your expense. So pay for it, and you can be released from quarantine. Otherwise, you would have to spend those 8 days in quarantine. As for tourists, we appreciate too that the resilient corridors are subject to a very comprehensive set of protocols, which can be seen on the Visit Jamaica website and also through the Ministry of Tourism. And so through that system, we can have continued tourism sector, which of course many of you can appreciate that Jamaica is heavily reliant on tourism. And so there are rules in place to ensure that we are able to carry on with our tourism industry and at the same time protect our tourists and protect our Jamaican citizens. Business travelers have to, and again, since we have in place the Jam COVID system, we use that system to monitor persons coming in. And of course, we ask that business travelers and all travelers take a PCR test or a COVID-19 test, antigen test or otherwise, before coming into Jamaica. And it has to be a negative test. At least we would hope that these tests are negative, and then you're allowed to enter. And business travelers, again, can also be released from quarantine within the context of the paying for your COVID-19 tests. Persons staying within the resilient corridors are all screened and the quarantine measures all obtained. For persons resident in Jamaica, they are allowed to quarantine at home, provided that they have the requisite facilities to quarantine within their homes. I think if there are, during the question and answer segment, I may be able to answer specific questions, but I think that would do it for the overview of the protocols as given by the Prime Minister on September 18.
Thank you very much, Ms. McLeod. I think we can go straight into the program now, 7:20. There is Minister Tufton on?
Yes, Ambassador. The Minister is on.
Yes, okay. Well, let me take this opportunity to first just congratulate Minister Tufton on his appointment, his recent appointment, where he served as president for the 59th Pan American Health Organization, PAHO, directing council meeting, which highlight the efforts of the minister and that led to a productive working visit to Washington, D.C. during the period of September 20th to 24th. I further must express my delight at Jamaica's election to the PAHO Executive Committee. These displays of confidence by PAHO and the Jamaican government are most encouraging, especially at this time. Minister, let me welcome you and take this opportunity to introduce you to the diaspora. I'm still not seeing Minister. Make sure it's pinned to the top.
Good afternoon, good evening.
Are
you hearing me?
Yes, I'm hearing you now. Yes.
Okay, great. Okay.
Minister, welcome, and it's a pleasure to have you on board to directly communicate and discuss what is happening in Jamaica with members of the diaspora, both here on the Zoom platform and on Facebook. Over to you, Minister, to just give an overview and then sit back and engage.
Okay. All right. So thank you very much, Madam Ambassador. Thank you and your team for organizing this diaspora discussion involving myself and by extension public health and the Jamaican government around the programs of public health, and in particular the coronavirus and our attempts at addressing the issue. Always very happy to interface with the diaspora community, very important extension of our own local population. We are one nation state, no matter where we are. And without the collaboration, we certainly would not be as well as we are, despite the challenges that we face. So I want to just thank you, but also take the opportunity to thank them for their role, their interests, and just encourage the continued participation. Your Minister Johnson Smith, sends her regards. I had a little dialogue with her earlier this evening, and of course she wishes all of you all the very best. I'm going to I just came out of a COVID conversation, which we normally have on a Thursday, and we adjusted the time to 4 to facilitate this session. And we gave a report, and I know that the diaspora, or members of the diaspora, normally tune in to hear what's happening. But just to quickly go through a couple of things around COVID, and then to allow most of the time for your questions, because I'm sure you have a lot of them. So you would have known, most of you anyway, that the third wave, which I'm sure you're accustomed to surges, the world is accustomed to COVID surges, has hit us fairly significantly. We had to pull back. We had to be extreme in terms of lockdown days, which means no movement except for essential services. And that went on for a number of weeks, almost a month, on a Sunday, Monday, and Tuesday. And then in addition to that, of course, you had the curfews during the week. This was because we had a surge that saw positivity rates in the high 40s, even 50 on one occasion. This is 50% of tests done showing positive cases, and community spread of the coronavirus, and in particular the Delta variant, which is the dominant variant now, in most communities across the country. The effects of the shutdown, which we have eased restrictions on recently, and the OPM's office through Kimberly spoke to that earlier, has seen our numbers trending down, which is positive, but not yet where we would like it to be, which remains concerning and remains for us to be vigilant. The most significant number that I think is important is the reproductive rate. And if you look at the chart up on the screen, you'll see where we are now edging below 1. And the reproductive rate is just the extent to which a positive case influences or impacts another positive case. For every one person that's positive, if you're at 1, they will infect one other. If it goes above 1, then they will transmit the virus to more than one person, and then over time you get an exponential increase in the numbers. Below 1, it means that for every one person they are transmitting to less than one person, which over time means that your positivity rates will come down. Ideally, you want it to be 0.7 or below, but we are below 1, and it was up to 1.5 when we were in our highest peak of the wave. What that means is that our positivity rate would come down, and it's now our 7-day average 26%. Now, by all standards, that's high because you really don't want to be over 5-ish or so, but it's coming from 50, so we're moving in the right direction. And then, of course, positivity rate affects hospitalization rates, and hospitalization rates affects death rates. And the charts here show that while we're still high, we are coming down from where we were at our peak. So the curve is now turned and moving in the right direction, and we'd like to continue to move it that way. It means, therefore, that while the government, led by the Honorable Prime Minister, has announced relaxation measures, we are still pushing for the protocols to be observed and still doing some work to prepare and to improve our infrastructure to accommodate persons who need hospital care while we push the vaccine message. So today I was at the University Hospital of the West Indies, where I officially commissioned a 40-bed addition for COVID ward. This is in conjunction with a number of private sector companies. It has the capacity to be expanded to 60 beds, but it's now able to do 40. This is in addition to field hospitals we have established at Spanish Town, St. Joseph's, Falmouth, and Maypen, and we are now in the process of completing one in Westmoreland, the Sablamar Hospital. And this is all intended on adding bed space, because as you know, the real threat to COVID, it overwhelms the health system and then creates challenges for treatment of persons who are affected. So we have done a lot to expand bed space, and I would say that the diaspora has played a role too by helping in terms of some of the equipment and the supplies for that, and we're thankful. Beyond that, we have, actually I should give you the numbers. In the last 24 hours, we have 913 persons in hospital, 650 are confirmed positive cases, 263 are suspected. And in the last day, the island recorded 251 new COVID infections and 9 confirmed deaths. And of course, we have had over the last year, the total number of confirmed COVID cases we have had in Jamaica is some 83,737. And the death toll is 1,869. All regrettable, but we continue to push to try and reduce the numbers. The vaccination program is the most significant response to COVID, as we all know. And in the early stages, we had an issue getting vaccines because our policy was to only accept WHO approved vaccines. We have since gotten vaccines, AstraZeneca, Pfizer, and Johnson & Johnson. Some we have purchased, others have been gifted to us. And the challenge now is to ensure that the outlets are there for people to take up the vaccines. And then, of course, to overcome the objections, the concerns, the queries that other persons may have for not taking, which is vaccine hesitancy. So we have three aspects to the vaccine program. One is to have vaccines in stock. The other is to have the distribution outlets to distribute. And the third is to convince people to take it up. We have in stock, except the Pfizer, which is a challenge for us. And I can come back to that later on if you so desire. We have Johnson & Johnson and AstraZeneca. In fact, we have some 568,000 doses of vaccines in stock. We have already administered some 781,496 doses. Approximately 10% of the population is fully vaccinated. Another 10% have a single dose to take the second. And overall, therefore, about 20 percentage points of the population have either had a single or a double. And that number continues to increase each day, but we would certainly like it to increase faster than it is. And as a consequence, we have done a number of things to expand that. We have recently signed contracts with private companies, 11 private firms, including pharmacies, doctors' offices, private hospitals, and they are going to be given the vaccines free, and they will allow for more outlets. Combined, that 11 location will provide another 55 outlets across the country. We have fixed sites that we have established in every parish that are predictably open on particular days and hours of the day. And then we have the community engagement where the MPs, Prime Minister was in St. Mary today. I've been in several parishes where we go into the communities, working with the health team on the ground to try and convince persons to come out and to take the vaccine. It's a real challenge because there are some, should I say, inbuilt, if you will, cultural dynamics at play where people are suspicious, the impact of social media. People have other options or alternatives that they think is better able to cure them or to protect them, whether it is faith-based or, herbs based. And so there is a lot of noise in the program, and the communication strategy remains an important part of trying to overcome that. And it is something that we are going to have to continue to push as we go along. Just two other quick points, and then I'll hand back to you, Madam Chair. The issues around the vaccine cards or vaccine passports, the US, we would have heard as announced, visitors coming in have to show evidence of being vaccinated. Today, I announced that we have embarked on the program to digitize our vaccination cards. We're now talking to a number of possible providers. We want to ensure that it's benchmarked against the significant global marketplace and the critical countries like US, Canada, the EU, so that information is being sought. We already have a database that's well established with all the persons who have been vaccinated. So it's just a matter of using that information to create a digital card. And we're hoping over the next 2 to 3 months to have a card and being distributed to the population, to those who have. We've also launched today a website, an app on our website for the shut-ins, their caregivers, to upload the information so we can now deliver vaccines at home. And we hope that would address some of the challenges that persons who can't move will face. Overall, I do believe that our public health team have done a fairly good job. They've been at this for the last 16 months or so. It's a real stressful time because we do not have the numbers that we would like to have. We've made appeals for retirees to come in, for vaccinators, for people to work in the health system. We have engaged the private sector now as contractors to help in that process. But the numbers are limited, and the demand for these skill sets, as you know, is quite high. And therefore, we have to work with what we have. The government has tried to give support in the case of the shutdown, certainly the Ministry of Health for all that it needs, as well as to persons who may be most affected because of some of the restrictions. And of course, the diaspora, you out there in, faraway land have been making efforts to contribute, which we fully appreciate, despite the challenges you have in your own space. I think I'll stop there and allow Madam Chair to take over and to respond to any concerns or questions or statements or suggestions. Thank you.
Thank you so much, Minister. I'm going to just take a minute to recognize some other persons, because as we have discussed, this forum is really to ensure that members of our diaspora will have a continuous way to communicate with the government, with me here in the US and with leaders from Jamaica on a occasional basis. We try for at least monthly basis, directly, where you can hear directly from all of us in the government as to what is happening. So I'm always very pleased to see the turnout and to see the participation. And so I want to recognize that, and we also include, we are now including more and more leaders here in the US who will contribute to the topics that we are discussing. Last month, we had Congresswoman Sheila Jackson Lee, and this month we are looking forward to be joined at some point by Congressman Dwight Evans. I know he's tied up in legislature, and I know our consul Christopher Chaplin has worked to let him know that he can come on at any time and we'll just recognize him. And I see Donahue Bailey here. I expect Donahue that you'll ensure that the congressman also will be here with us tonight. I haven't seen you for quite a while. I want to recognize Mrs. Clover Hall and the members of the Atlanta Jamaican Association. We did not mention you earlier, and I know you have turned out and you're doing a lot to help us. I also see that Honorary Consul David Sangster is here. I did not expect to see Ms. Carlene Largy and Ms. Leslie Ann Samuels, because this is not education, but I forget you're always involved with diaspora affairs, so it's good to see Yusha being represented as usual. Dr. Terence Foster. I also want to recognize the members of the Professional Jamaican for Jamaica, and that is a famous name, Mr. Horace Daly. And we also recognize the Jamaican Nurses Group of New York, and members of the media. I saw Mr. Derval Malcolm, Mr. Ian Edwards, Mr. Carol Emlyn. I see quite a few members of the media, and I appreciate your work with us to get out the information. Minister, you mentioned that there are persons here who are contributing quite a bit, and I know that Dr. Karen Dunkley, the Consulate of New York, and some of our medical professionals are organizing themselves to have missions to Jamaica on a continuous basis between now and between September and December. So I will ask Dr. Dunkley to say a few words.
Thank you so much, Ambassador Marks. All protocols observed and established. Ambassador Marks, we really look forward to our monthly series, or Let's Connect with You. And thank you again for the forum, the opportunity to communicate, connect, and collaborate. The Jamaica Diaspora Northeast, along many partners under the auspices of Consul General Althea Wilson in New York, will launch a COVID-19 medical mission to Jamaica. And we are hot and moving. We have over 60 plus persons, volunteers registered so far. We are really asking for physicians, respiratory therapists, as well as nurses. And the purpose of the mission is to provide human resource support to our healthcare counterparts in Jamaica, specifically at the Savannah Lamar Hospital in Westmoreland. And we heard Dr. Tufton mention earlier that they're building a field tent hospital there. And that is where, in particular, we will provide support. The first deployment, we're calling it the first team, the advanced team, will be in Jamaica on October 17th. And then we will have teams of 10 led by different doctors, including our lead partner, Dr. Trevor Dixon from Jaja Foundation, Dr. Robert Clark from Help Jamaica Medical Mission, And Dr. Gary Rule, who is a Jamaica Diaspora Northeast co-chair health sector, will lead different teams at different point in time. So what we would like to ask for, Ambassador, is for support from the community. We see many of the leaders here who have shared the flyer, shared the information, who are recruiting. Please direct individuals who are able to volunteer, fully vaccinated volunteers, to go to janed.org, janed.org to register. And just a quick note, Ambassador, to acknowledge again the planning team. We have Ms. Claudette Powell, who is our co-chair of the Jamaica Diaspora Northeast Health Sector, Dr. Gary Rule, also co-chair, and Dr. Trevor Dixon and Dr. Robert Clark, Jaja Foundation and Help Jamaica Medical Mission, as highlighted earlier. We also would like to communicate that we have a strong focus on mental health. Lorraine Smith, who is a nationally certified mental health expert, will provide counseling services. We know that COVID-19, and someone has feedback, Raymond Parkinson, if we could mute that person. So we know that mental health certainly is of concern, and we want to tend and destigmatize mental health. And Lorraine Smith will offer mental health counseling and telecounseling, Ambassador. So for those who are not, we can will certainly provide the services by phone. And finally, we will have drop boxes. And I'm hopeful that Dr. Dixon at some point, and Claudette, Dr. Rule, and Dr. Clark, that they would share. We do have drop boxes because we need medical supplies. The list of supplies needed is at janed.org. You could click to see the list and click for locations for the drop boxes in New York and New Jersey. And we're thanking CG Wilson, who will ensure that is shipped to Jamaica. And shouting out Dr. Elaine Knight, JNA, Jadias, OID, Dr. Roy Street, LJDR, the Jamaican Nurses Group of New York, and NEJAC, our partners. So thank you again, Ambassador. Again, the goal is 100 persons to provide support for our healthcare workers at the Savannah Lamar Hospital. Thank you so much, and we're open to questions. I'll put our email in the chat for anyone who would like to connect with us if they have additional questions, feedback, or insights. Thank you.
Thank you, Dr. Dunkley. And again, I know Minister will respond, but we appreciate the support from so many persons, so many medical professionals who are giving of their time and their expertise to the situation in Jamaica. We'll hear shortly from Consul General Mayor of persons from the southern region of the US who are also giving much resources and time. But before we go to Consul General Mayor, let me just see if there are some questions for Minister that are immediate, so we can engage the Minister as soon as possible. Do you have questions? I don't see any so I will go straight to Ms. Alicia Taylor, who takes some questions from the chat.
Thank you, Ambassador. Sharon Smith had her hand up earlier, but until I see it again, I'll go ahead. So Minister, we have a number of questions, so I'll read the first three and have you respond if that's okay. So the first from Delroy Morgan, it says, are you finding that most Jamaicans are following the rules in wearing masks and following physical distancing? And the second is, what is the indication that tourists are bringing in the virus? And the third question, I learned that 66,000 vaccines are set to be dumped. Is this a fact?
Minister, were you able to hear all the questions clearly?
The last one was a little muffled, but I suspect, I think she was asking, the person was asking about the vaccines that are to expire today. I think that was it, but
yes, well,
confirmation, yeah. Okay, so I'll comment on that also. But I just want to thank Dr. Dunkley and the mission that she is leading for Jamaica into the parish of Westmoreland. I think it's welcome, and whatever we can do to support the mission, we're more than happy to. That parish has had its fair share of outbreaks, and that hospital in particular has had significant challenges in terms of bed space. We've had a number of deaths, and so any support at all would be excellent. And I got an update today on the field hospital, and I know work is going on as we speak. So hopefully by that time you will have a facility that can allow you to function and to provide support for the hardworking team that's there. On the questions, the issue of mask wearing, well, a lot of Jamaicans have been observing the protocol, and I really want to commend those who have. There are others who have not. In the early stages, COVID there was a big fear factor, and so persons really responded to the advice that was given. Over time, I think a level of fatigue has set in. Persons have become, frustrated, and sometimes understandably so, with the shutdowns and the restrictions, people who have to work, and some of the frustrations and the fatigue have manifested themselves in some persons just not complying. The net effect of that, of course, is that it allows the virus to spread more. So we have to encourage it, and in some cases enforce the rules that have been placed on the population as part of the response. But generally, I would say that a number of Jamaicans have complied, but certainly I would say a fair bit of Jamaicans have not. And so the messaging has to continue to be strong. The second question of the vaccines and the expiration of the vaccines. I'm trying to make out what the second one was. I know the third one was about expiration. The tourists, right? Whether or not the tourists are bringing in the virus. I have to say that the virus is transmitted people to people, and to the extent that it is in Jamaica, it had to be brought in. I would not say it's just the tourists, because I know there are some restrictions on screening with persons coming in and going out. I would say anyone who comes in has a risk of spreading the virus. I'm sure some would have come here on holidays, whether they are linked to Jamaica or totally new to Jamaica. So I don't think you can rule out that impact. But I also think that we also, having brought it here by coming in, have spread it amongst ourselves by not abiding by some of the protocols. So we still have persons, not wearing the mask, as I said earlier, moving around freely and not practicing the protocols that we have imposed. So I would not place all the burden on the tourists or persons who are coming in, but clearly it came here by bringing it in, but we have also contributed to the spread internally. It requires all of us, therefore, to set the protocols, whether in the resilient corridor, in the hotels, or in the marketplace or the bus parks. And that is the approach that we're taking in terms of a strategy and outreach. The expiration of vaccines, yes, we do anticipate that at midnight tonight, we would have some 50,000+, maybe 58,000 AstraZeneca vaccines that were gifted to us from the UK with a 2-month lifespan. 300,000 was gifted. We have used up approximately 240,000, and there is just under 60,000 that is unlikely to be used. We still are open up till 8 p.m. in some cases, so we don't have the final figure. But we do have a policy not to use expired vaccines. And so when that time comes, the vaccines will be destroyed. We do have vaccines in stock, as I said originally. So it should not stop the program from advancing, but that expired batch would be destroyed, yes. Thank you.
Thank you, Minister. We'll now ask Ms. Sharon Smith to unmute.
Okay, good night, Minister, Ambassador Arjuma, and everyone on this call. Now, my question is, I'm part of a very active, vibrant group, which consists of some of my fellow schoolmates in Jamaica. My question is, Minister, do you think your health sector has communicated enough where the vaccination is concerned? Because when I listen to these guys and girls, they're lacking information about what exactly, you know, the vaccination is and what it's about, what COVID is, and what does it bring, and the dangers of COVID. So that's my question.
Thank you. Minister?
Oh, okay. Right. So thank you for that question, Ms. Sharon Smith, a familiar name, by the way. The question has merit in that, you know, we are always open to review and to learn from the experiences of the immediate past as it relates to the type and the format of the communication that is necessary to reach the population. You know, and so I always accept suggestions, criticisms, recommendations, and I approach, we, the public health team, and indeed the government, have taken a position and an approach to this COVID response with a very open mind, because there's no playbook for this. This is a 100-year experience that doesn't have a playbook to how you address it. There are some fundamental principles, but those principles have to be adjusted based on context, based on culture, based on subsets of the population. So one of the fundamental principles of the response to the crisis and to crisis management in general is to communicate and to always and keep consistently speaking to the people that you provide leadership for, to get them to understand the nature of the crisis and to provide guidance on how to deal with that crisis. There is no doubt in my mind that as a government, we have over the past year and a half invested heavily in communicating. I have a weekly press briefing called COVID Conversations every Thursday. We hardly miss a Thursday. We have additional ones if needed. When we just started, we almost had daily ones. The Honorable Prime Minister has multiple press briefings in the early stages, significantly. And in a sense, we were doing 2 a week almost for some time. Him doing one at OPM, I'm doing one at the ministry. And it was all geared to providing the population with information. The truth is, over time, that in the population's interest in some of that information has waned because of fatigue, because of other issues. And the information has had to change too, from telling them what COVID is to explaining how they can protect themselves, from non-clinical measures, mask wearing, to now taking the vaccines. We are now at a more complex process of communicating because we have to communicate several messages at this point, because vaccines now represent a big part of all what we do. And the truth is that vaccine message communication is competing with all sorts of other messages out there on social media. There are, people who will tell you that God will take care of them. A man told me that yesterday in St. Elizabeth. Or that he has the remedy because he has done certain things, bush medicine, whatever. And you have to now tailor communication and go into that the communities and so on. So, to respond to that question is not a yes or no. Do we try our best to communicate? I think we do, the government, the ministry. Can we do more? I think we can always do more. And we will just have to keep going at it until we can get the targets that we set for ourselves. And that's what we're working on. And we do ask you to help us, because if you think there are gaps in your population that you communicate with, and you're a believer in the vaccination, I told them at UWI today, it's up to all of us, one-on-one, to get a convert. This is almost an evangelical mission to convert persons, because vaccines are safe and they remain the most effective approach to solving the problem. Thank you.
Thank you, Minister. And probably
am I able to go ahead?
Who is speaking?
It's still Sharon, just responding back to the minister. Am I able to?
Please go ahead. Yes.
Okay. Okay. My family name is Sharon Smith. I'm the sister of Veronica Baker, and a member of the Northeast Diaspora security team with Dr. Dunkley. I do try my best to break down to these, because some I have converted. What I use is using vaccine that we used before, using that format that, we used to use that vaccine. We didn't know what was in that vaccine. This is just a step up of this. You explain that COVID, COVID is another form of flu. And, those are the things that I use. And I've converted my mother and a bunch of her church persons. So I'm saying, if we could break down the communication to these persons' level so that they can understand it much better on a more national level. Thank you.
Thank you. Thank you very much, Ms. Smith. Minister, you had shared one of the reasons why I think it's so very important for us to have this dialogue with the diaspora. You shared a story with a family where the parents died based on just the advice from their children here in the diaspora. Can you just share that with all of us and just emphasize the role of the diaspora on their family and friends, their loved ones in Jamaica? You could just speak a bit more about that.
Right, so thank you for that. So the issue of the type of vaccines that are available and the preference for vaccines is a real one. Right now, we have 3 brands that we have introduced to the population: the Pfizer, the AstraZeneca, and the Johnson & Johnson. All 3 have gone through extensive clinical trials, have been deemed by the experts to be safe. And the cardinal rule, the rule of vaccine taking, is that you take the first one that is available, because you never know what will happen tomorrow or the day after in terms of exposure to the virus, particularly if you have underlying conditions which makes you more vulnerable. But the truth is that persons have preference for particular brands for different reasons. And again, the diaspora, which is a large group of very influential Jamaicans or friends of Jamaica, have significant sway in Jamaica in terms of their experiences. And because I think the Pfizer brand is the most common brand, popular brand in the US, many of our locals here, as they would do in any case with other situations, may ask for advice, which vaccine you take, which you think it good, you think it's that one I should take, for example. Being parochial here, no disrespect intended, but just to make the point that sometimes the response around recommending, which may be solicited or unsolicited, determines how we weight, posture, or express a preference. And I'm saying this to say that literally sometimes it makes a difference between life and death, because some people die waiting, because you never know where the virus is. And I humbly suggest that based on all the clinical expertise, the WHO rulings, our own local clinicians who are excellent at what they do, that to the extent that we can play a role, and we do play a role, we meaning the diaspora, every one of you have a neighbor, a relative, a close family friend, a district that you're close to, that you keep in touch with, that you help, that you send remittance to, you send barrel to, you visit once a year or once every other year, you have a community project. I mean, listen, we are so intertwined. As I said, the nation state of Jamaica is 5 million people, is not 3 million that is here. It's the other 2 or 3 million that is out there, including you here online in the diaspora. You can help. You'll be surprised how you can help to convince Jamaicans to take the vaccine. And I humbly suggest that you advise when that argument comes up. Indeed, you should raise the argument to advise that they take the first one they have access to, because AstraZeneca will save them just as Pfizer will save them, and Johnson & Johnson will save them just as Pfizer will save them. What is very true is that the people who are dying and ending up in the hospitals are the ones who have not taken any vaccines. I took the AstraZeneca and I'm quite comfortable with it. And I can understand why in the American population, Pfizer is the most popular. That's the one that's been most available. But that is a real issue. And so I encourage us to help others to take a vaccine, not a particular vaccine, because that is a much less risk than them waiting on a particular vaccine brand. Thank you.
Yes, and just to emphasize the point, Minister, is that the parents died waiting for the particular brand that was recommended by the children.
In fact, I know of several persons. Yesterday, a friend of mine, he's in his 40s, died at 4:30 p.m. at an hospital in rural Jamaica, waiting on the Pfizer vaccine. A month and a half ago, someone else I know about died waiting for the Cuban vaccine. And I'm not saying, I'm saying this just to drive the point home that you can't wait. We have vaccines. Take the vaccines that are available. It's a real issue. And again, the diaspora has significant influence over people that they speak to every day or every week. Just say, take the first vaccine. You have, Jamaica has safe vaccines. All the vaccines are safe. Thank you.
Thank you. I know we have some more burning questions from the chat. So Ms. Taylor, I'll come back to you for 2 or 3 more questions for the Minister.
Thank you, and just to add that Mr. Dean Roden has had his hand up for a while. So after my 3 questions, Ambassador. Minister, there are a number of questions in the chat relating to sourcing Pfizer vaccine. It said, what is the time frame for the 2nd dose and how long is the window between the doses? As this person says, their son has been scheduled to have the vaccine on the 28th. And what will happen if it doesn't come, and will they have to mix vaccine? So that's one question with a number of parts regarding the Pfizer vaccine. Second question relates to Jamaica still benefiting from the service of the Cuban medical team. Is Jamaica still benefiting? And the third question, suggestion is that you share information on the Adopt a Clinic program with the diaspora.
I know there are many questions. The Pfizer vaccine, initially we had said we would administer the 2nd dose after 3 weeks, but the lack of the availability based on the clinical advice is that we could go up to 6 weeks. Although in some jurisdictions, in Europe, for example, in the UK, I think there was a time when there was a wait up to 12 weeks for the administration of the second dose. So while we are a little uncomfortable that, well, we are uncomfortable that we did not, or we do not have the second dose to administer. And that is a function now of the discussions that are taking place with the US, and we hope that we'll solve that problem in short order. I know Madam Ambassador is working on that also, and the Minister of Foreign Affairs. We are not suggesting to persons that somehow they will lose the effect of the vaccine, given that we have seen cases of up to 6 to 8 weeks and even up to 12 weeks for the second dose. So that would be my response. And we do anticipate that we will get our second batch, and that 80 or so thousand that are waiting on second dose will get theirs as a priority. And then afterwards we'll go to the children, because that's the vaccine that is available for them. On the issue of the mixing of vaccines, the clinicians are not yet are not yet convinced that we should. Where it has been mixed, the Pfizer brand was the second of the two. In this instance, the people we have waiting are people who have had Pfizer as a first. And so, we have not taken that decision locally to do the mixing. And they are guided by the WHO experts. And that is what has guided our policy position for immunization for some time. And we are at the point where we have not agreed on the mixing at this point. And then the third question around the Cuban medical team. Cuba remains a very important part of our partnership for public health care. I think we have about 500 or so Cuban nurses primarily, but also doctors here. When we had the start of the COVID process, we brought in over 150, and they have been very critical to our outreach and providing medical service, and we're very grateful to them for that.
Yes, can I go ahead now? Yes, thank you, Ambassador Marks. Good evening, everyone. Honorable Minister, all protocol observed. It is indeed a pleasure for me to be at this forum. And I just want to let the 118 people know that we're on the forum that I am a victim of the COVID, and I'm ready, willing, 1,000% to be a person to tell people about the real COVID. They don't have to download it. I was hospitalized for 1 year. 1 year and 2 months. I've seen my roommate chest go up and down. Over 20 people die in my facility. I was one of the first person to take the mask, and I took the vaccine. So when I hear people talking about the COVID is not real, I serve at the highest level in scouting. I train the top scouts in America. I sleep for the past 30 years. I slept with bears and raccoons and skunks. So I sleep in the woods. So when I hear people talking about the COVID and all these things, so indeed, Minister, I just want to let you know, I want to thank you for the hard work that you're doing. And I'm always here, willing and ready to just tell my story. Just tell my story, sir. Thank you very much for having me on this forum.
Thank you, Mr. Roden. And we are so happy that you are back with us and looking well. Thank you. Miss Newman.
Can you hear me? Hi, good evening. All protocols observed. My only concern is how informed the administrators of the vaccines are. Reason for asking is I read about a case today where someone was due to have a vaccine, a second dose, which was actually supposed to be for tomorrow, but the person came today and it wasn't given to the person due to the date. Is there any flexibility or what would the difference be if that person was vaccinated today as opposed to being vaccinated tomorrow, though it was supposed to be for tomorrow? Why couldn't that person get that vaccine today?
Okay. Before Minister gets back to answer the question, we have two more raised hands. So let me just make a note, Minister, of Ms. Newman's question, and let me just ask Dr. Morgan to unmute, and then Mr. Sharp.
Hi, good evening all protocols observed. Thank you for having me on the forum. In regards to disseminating the information or passing it on to the public, have we engaged the churches to assist in providing that message? Say, for example, if I attended St. Joseph Catholic in Spanish Town, I might be one of the persons who, while attending Mass, would be able to get up and say, hey, listen, here we have a vaccine. This is why we need to take the vaccine and the importance of it, and answer any questions in the pew that people might have, because I think being able to touch people right there and then and having someone to answer those questions that they have might go a long way. Thanks.
Thank you, Dr. Morgan. And Mr. Sharp?
Good evening, Ambassador. Great job. Love the engagement you're doing with the diaspora and us. My pet topic, and everybody know me, I'm advocate for disability community. Minister, you're doing a great job in terms of the rollout, because I'm a CBO of the vaccine outreach here in Massachusetts. I work with 3 cities, and I love how you're hitting the road in various areas like what we do here in the diaspora in our community in Massachusetts. So kudos for that. My concern is just to find out, how are you in terms of getting this information out to the disability community? What are some of the plans that you have in place in terms of our disability folks? Yesterday, I was at the launch of the closing of our phase 2 of the vaccine clinic here in Boston. And when I heard from the For the Blind organization who was providing outreach support, it flashed back to me, and I'm saying, wow, look at that. You know, how can we get these people who are disability to learn about access to the vaccine, you know, especially those who are physical, disabled, and so forth. So I just want you to answer that question. Thank you.
Thank you, Mr. Sharp. And Minister, just add one more question from Dr. Rosemary Lewis before you answer.
Okay.
Dr. Rosemary?
Yes, good evening, everyone, and thank you for the work that we do in the diaspora. I am from the Southern Diaspora. I will be joining the Northeast to go to Westmoreland. When I asked one of the nurses to accompany us, the question was, why do we not?
Technical matters. The explanation I have heard would be around the efficacy or the effectiveness of the vaccine in terms of the minimum period from first to second dose. And, you know, some persons would come 5 days, 7 days before. There is some flexibility sometimes that is extended, normally within a 48-hour period, I am told. But generally speaking, the clinicians or the clinical recommendation is to come on the day due as the ideal date, and that you are likely to not benefit fully from the vaccine if you come prematurely. And so that has been the issue. Now, I know people have been taking issue with it, and in light of the expired vaccines or the imminent expiration of vaccines, persons have been saying, why not allow people to take it, you know, a week before and so on. Our objective here is to ensure that you get the maximum benefits from the vaccines. And so, you know, we are doing what we think is clinically correct. And I can't contradict that sort of decision making based on what the experts say. So that's why we are where we are as it relates to that. As it relates to the influencers, the role of the church, I do take the point. I have met with all the significant church, the umbrella church groups, the Council of Churches, the Evangelicals, the Anglicans, the Catholics, the Seventh-day Adventists. In fact, we had a press briefing in Kingston with all the leadership endorsing vaccines. We recorded videos, put them out. So yes, and we provide information for them. And we have offered to do vaccine blitz in communities, in church halls. So we're doing exactly what the gentleman spoke to, I think the last contributor. We have done the same with the trade unions because the workers' representatives have influence. We have done so with some entertainers. We have done with the private sector. So we are and have been using all the critical influencers because we know that politicians alone, ministers or otherwise, may not carry the credibility in all spheres and maybe in the least number of spheres, who knows? So we have to now reach out to other critical influencers. And I have absolutely no difficulty, and that's actually a policy. So we do that. And whenever a church reaches out to us, we make our medical team available to go and to speak. The disability community is a real issue. We have gone out and made it a policy to visit institutionalized individuals. We have gone to all the infirmaries, for example, because in collaboration with Minister Mackenzie, local government. We have reached out to individuals who are not mobile. In fact, today at the press briefing, we launched an app on our website where caregivers can upload information on persons who are not mobile, they can't move, so they're in their homes, whether institution or private. And then the parish health offices will reach out to them. And if we have to do home visits for vaccine application, then we do that. The other institutions that have various forms of disabilities are also able to access teams that come in because we do have a mobile team. So the answer to your question is yes, we are providing that level of service. The final one on the staff, the need for personnel. Yes, we need supplies. We always welcome supplies, even though I would say that the government is very able to. The government has never been unwilling to commit to procuring what is needed to deal with the COVID response. But we also recognize the important contribution to of our diaspora and others who support Jamaica. We have a unit in the ministry, the Health and Wellness Foundation, headed by Mr. Courtney Cephas, who I know is online, and he would be the one, he and his team, who coordinates these arrangements. But we need people. There's no doubt about it. We lose a lot of our professionals who are trained. Some of you are online now to the opportunities that understandably so are available in the developed world of North America, whether Canada, the US, Europe. We're not complaining about that. This is a mobile environment and labor mobility is important and we embrace that. But we suffer from it. That's just the reality. And as a consequence, particularly now we have a crisis, we need people. So we have launched ads around bringing back retirees. Some have come back in, getting private sector to do some of this type of work. Our public sector workers have been working double and triple shifts sometimes. I mean, fatigue is a significant consequence of the COVID response over a year and a half. Fatigue. A lot of very tired people, very fatigued people. And I must tell you, when you're tired and fatigued, you get irritable, to use a Jamaican term. And it's sad. It's really concerning. So to the extent that we can complement and support with a visit from a team of Jamaicans or friends of Jamaica, we welcome it because it gives our local people a break. It shows support and unity of effort. It motivates, it strengthens their, shows them some recognition of their efforts. So we welcome it fully and embrace it fully. Thank you.
Thank you, Minister. And I think members of the diaspora needed to hear that ringing welcome of your time, your resources, but also your time and your expertise to help in Jamaica. So thanks, Dr. Rosemary Lewis, for asking that question. I know there are 4 persons wanting to ask questions, but I just want to say one thing and then ask Council General Mayor to speak. First, I know quite a few questions are coming up in the chat about Pfizer and exactly when it's going to be coming into Jamaica. So let me just remind you that the United States actually donated 600,000 doses of Pfizer vaccine to Jamaica, based on the trend that we normally had in Jamaica of how the vaccines are taken up. There's a schedule that was initially in place. The Pfizer vaccine take-up was actually way ahead of schedule. As Minister said earlier, the brand was more popular. So we used up that ahead of schedule. We have now put in for the second tranche. In fact, we are putting in for second and third, just to ensure that we don't have the situation again. And we were told just about the first week in October, we are working on it and expect that something will happen soon. The doses have been contributed already to Jamaica, but in terms of on paper, but the US is doing a global donation of vaccines. So they are very stretched. So we are just trying to make sure we get in as soon as possible, but we are ahead of the schedule of the next tranche. So we are now pushing to make sure that happens. We expect very soon. And as soon as I get the date, Minister of Foreign Affairs and Minister of Health, Minister Tufton, will be announcing it. So I see all your questions. I just want to assure you that we are working on it, and the US is fully committed to ensuring that Jamaica will get the full amount that they have committed, the 600,000 and more, now that President Biden has announced another 500 million in contributions to the global community. Because we all know that, even if the US reached 70% and the rest of the world is below, we are all in danger. And that's a common understanding now in terms of the global diplomacy policy of vaccine distribution from the US. Let me just ask Council General Mayor, you heard the minister say we want both time and talent and resources. And I know your region, you have been doing some wonderful things in sending supplies to Jamaica. And I want to encourage everyone in the diaspora to get familiar with the needs for support in terms of not only what is being done with the team, Dr. Duncan, the team out of the Northeast, but wherever you can send supplies, I want to encourage you to do so. Council General Mayor.
Thank you so much. Thank you so much, Ambassador Marks, and congratulations again on this lovely program. Minister Tufton, we thank you as well for your ongoing work. And I want to especially recognize Mr. Courtney Stephens, who we call almost once a week. Thank you for your ongoing efforts. Just want to say big thanks to everybody on this call for your support, your engagement. Special thanks, of course, to our region in the Southern United States. I want to recognize some folks who have made some contributions. Memorial Health System, Jamaican Doug Harrison, they've given us pallets of sanitizers, PPEs, respirators, gowns. Dr. Smith, I see you on. Consistent work over the years. We need to give you a big, big round of applause. Atlanta, Montego Bay, sister cities, recently gave us 15 oxygen concentrators, 4 oxygen high flows, disposables, PPEs, gloves, sanitizers, personal care packages valued over $70,000 US. And this is an ongoing effort from Dr. Smith and Sister City. I want to recognize a group out of Orlando, along with the National Air Cargo, who've made a donation of 300,000 disposable medical gowns. And we will be giving some of that in addition to what's going to Jamaica, some to Haiti as well. Our hardworking Jamaica Nurses Association of Florida, we didn't mention you before, but big up True Jamaican Style to hardworking nurses. They make regular contributions. In fact, just a week ago, they had a donation to KPH and Bellevue Hospital, as well as the St. Anne's Bay Hospital, of masks, sanitizers, hospital bedding, equipment, monitors,
We thank you, and they're putting a list together of volunteers for Jamaica. Shacks Hope, Angels from Heaven, and our churches and alumni associations. I want to thank Food for the Poor, who has been giving us ongoing support for transporting these items to Jamaica free of cost. Of course, Caribbean Logistics, Global Emergency Management. I want to recognize Dr. Foster, who is on from Atlanta. They just adopted a clinic in St. Thomas. So I want to recognize you, and our recent 5K run will adopt 3 clinics in November in St. Mary, St. Anne, and St. Catherine. And yes, I want to just thank everybody for your ongoing support. It is deeply appreciated. Let's continue to work as one unit, one body. And thank you for everybody. I want to recognize Jamaica Men of Florida, Jamaica Women of Florida for joining in the effort. Dr. Cunningham on the call. It's one effort, one team. Minister, you have our support here in the diaspora. We'll continue to support. Thank you.
All right. Thank you, CG Mayor, speaking for all the persons who don't have a voice tonight and making sure they know they are recognized and appreciated. All right, we'll go right back to some questions, and I know Mr. Trevor Smith, Dr. Yvonne Smith, Mr. Denton Lloyd, and Mr. Gary Hamilton are waiting to speak. So we'll go straight to Mr. Trevor Smith. We're not hearing you.
Can you hear me now?
Yes.
Okay, thank you. All protocols being observed. It's Trevor Smith from Sousabone Media Network, Sousabone Radio. I remember the last conference you did. I had you posted on Alignable, LinkedIn, and other places. You got about 3,000 persons who listened to your broadcast. I'm recording at the moment, and with some editing, it will again be posted on the Sousabone website. It will be broadcasted on the radio program in New York and in Atlanta multiple times, okay? Except for some slight editing, normally it is posted in its entirety, okay? But my quick question was in regards to people who have recovered from the COVID, because when this started, people who recovered from COVID felt that they were quite safe with some form of immunity based on the fact that we never expected them to get it twice. Is there any history of them getting COVID twice at the moment in Jamaica?
Okay. Thank you. Thank you, Mr. Smith. Dr. Smith, Dr. Yvonne Smith.
Thank you, Ambassador Mark and Minister Tufton. My question relates to the process. You mentioned needing help for the doctors and the nurses because they're suffering from fatigue. However, is there anything in the works to streamline the process to getting people into Jamaica to help? Because it takes a very long time to get the documents and the paperwork in order to get clearance to come into Jamaica. And that's always been a challenge. I would hope that in these kind of emergencies, that there would be some kind of protocol that would streamline the process and make it easier for people to volunteer and come into Jamaica to relieve those nurses and doctors.
Thank you, Dr. Smith. I can tell you that before this, the big complaint was on getting supplies into Jamaica. And we have been, before Minister Ansel, just want to say that we have been working very hard with the Health and Wellness Foundation, headed by Mr. Courtney Cephas, to put a simpler process in place. And Ms. Alicia Taylor here from the embassy is now able to guide persons. And you heard CG Mayer spoke earlier, and CG Wilson, she's not on, but all of us are putting in protocols to ensure, and all the honorary consuls that are on, to ensure that we can move supplies easier to Jamaica, and for you also to know what supplies are needed. So we want to really make sure that information goes out. But Minister, I'll leave you to answer the question on how to make the process simpler for qualified professionals to come in and support. Let me ask Mr. Denton Lloyd to speak. Mr. Lloyd?
Good evening. Can you hear me?
Yes, we're hearing you.
Can you hear?
Yes.
Yes. Thanks and good evening. Thanks and good evening, Madam Ambassador and Minister Tufton. I actually typed the question, but I will voice it here. As someone who hails from the constituency for which he represents, I'd like to hear from him what's the situation there regarding COVID cases, deaths, etc. Because this past week I learned 2 individuals of whom I know from a district we are from who passed away tragically because of COVID. And secondly, I happened to have watched talk show with former Prime Minister Bruce Golding, and he had on there Dr. Leakan Samaj, and they were addressing the whole matter of communication. And Dr. Samaj pointed out, rightfully so, that the communication has not been well done, and you're kind of using a one shoe fit all to communicate to get the message across to the citizens. And you suggest that you need to go a different route because everybody have a different, for want of a better term, a different love language. Not everybody hears things the same way. So I asked a question, are you mindful of this and you plan to address this? Thank you. Okay,
thank you. I'm going to just have Minister answer those questions, and then we'll have the last 2 questions before we wrap up. Minister, you want to just answer those? I think there are about 3 questions.
On the first one, I don't like to venture into the clinical space about whether you can catch COVID twice and all that. I've heard that you can. I've heard the clinicians say there are some cases. Some of those cases may not be a lot, but it's possible. But the way to look at COVID is, and I think we have to shift the focus around reporting and worrying about positivity and more concerned about survival, hospitalization, reducing that, and clearly reducing death. The vaccine doesn't prevent you from getting COVID. What it does, it protects you if you should get COVID. The people who are in the hospitals and the people who are dying are all persons who are either unvaccinated or in a few cases, they have had 1 dose of a double dose. And normally when they take that 1 dose is when they realize they have COVID because they waited. So the real strategy or policies around supporting the strategy is to not get your health system to be overwhelmed. So I wouldn't be overly caught up about whether you can get it twice or so. I mean, the vaccine builds immunity. It reduces the risk of getting it a second time. But even if you were to get it, it reduces, perhaps even eliminates the risk of your dying from it. And what we're talking about is saving lives and reducing hospitalization. The second question around how to allow practitioners to come into the country. So we have this unit, the Wellness Foundation. They will have to interact with the medical council or the nursing council, as the case may be. But we do appreciate the urgency of the current situation. We do intervene when we need to. And I think the unit has a good team led by Mr. Cephas. They have done a lot in terms of making it a lot easier to clear things, to bring in equipment and so on, working, of course, with Ambassador and her team. What is going to be very important is that you provide the information early, because part of the challenge that we have faced when I look at the situation is that a lot of times when people complain about not getting through is because they submit the information late. So you want to travel next week, and you submit the information this week and you want a turnaround in a record time. Or in the case of equipment, some people wait until it's shipped and at the custom, and then they're inquiring about clearing. And at that time, it becomes very difficult. So provide the information early and we will accommodate as best as possible, particularly in these emergency situations. In terms of the deaths in St. Catherine, and the last question is suggesting St. Catherine, West Central, my constituency. I don't have a figure on all the numbers, the unfortunate deaths, but there have been a few. What I will say is that we have embarked on a series of vaccination blitz in the constituency. We had a first one where we had 1,000 persons on that particular day. We set up 3 sites throughout the constituency. And then we had a second job blitz yesterday. And so we are making effort. In addition to that, people can travel to Spanish Town and so on. And it's my constituency, but obviously I'm Minister of Health. So I try to make sure that everybody is taken care of. And we're doing that. The communication question that you raised, I didn't hear the conversation with Dr. Samaj and former Prime Minister Golden. As I said earlier, though, we are always open to criticisms. We believe we can always learn from any mistakes or evolve as things change. But we do believe, I certainly believe, that we have tried our best to communicate all the information to be as transparent as possible, including bad news. We don't wait until somebody else talk about the challenges or the bad news. We make it available. And in terms of the vaccines and take-up, it's not so much for a lack of communicating as it is perhaps for how and what you communicate. And that's a process. We review it periodically and it evolves over time. Thank you very much.
Thank you, Minister. And now I'll increase our last 2 questions to our last 4 questions. I think the next person would have been Mr. Gary Hamilton. Let me ask you to unmute. Mr. Hamilton, you're from Westmoreland. I hear there's a whole team going down to Westmoreland. Are you on?
I am extremely elated to hear that. Born and grown Westmoreland.
Can I just ask you to hold 1 minute because I'm just need to recognize our beautiful state representative, Donna McLeod, that she's on. Just want to say welcome and thank you for sharing with us. And if you have anything that you'd like to share, please let me know. Please continue, Gary.
Thanks again, Madam Ambassador. Wanted to congratulate all the healthcare workers who are actually on the panel in terms of it's a challenging time and they're doing a tremendous job. Want to also commend Dr. Tufton. I work in healthcare here in the U.S. and I've designed and built and renovate quite a lot of hospitals all over the country and internationally. One of the major challenge that we have in Jamaica is the fact that we have a failing infrastructure in terms of our healthcare system. This is something that's not due to any one person or one administration. It's we just didn't do a good job in maintaining our facilities and building new facilities to meet any type of challenges and especially these pandemic challenges that we're going through. So I have to commend the Ministry of Health in terms of what they're doing and trying to do. And we just wanted to ask the Diaspora to continue to encourage people to take vaccine because that's the only way we can prevent people from going into these facilities or going into because it's a challenge in itself. I worked through the whole pandemic with helping healthcare facilities with dealing with the pandemic. And I should tell you that most of the hospitals in the US cannot handle and did not do well with handling the pandemic and pandemic patients. So if the US cannot deal with it, we'll have to understand that Jamaica has no way in where we are to actually deal with it. And currently, I'm actually just contracted on working on the Cornwall Hospital project, doing some project management and commissioning work as well. So we want to implore on you, if you can go back and help in any way, if you could extend your expertise, you know, to your country, if you could, that's something that could help our current situation. But, you know, we're still halfway through the pandemic. We don't know when it's going to be ended. So continue to be vigilant, continue to spread the word, continue to educate, you know, the people on the ground in Jamaica, and just convince them to take the vaccine, and not to take a particular vaccine. Just take any vaccine that's available to them at the moment.
Thank you. Thank you, Mr. Hamilton. Let me go straight to Dr. Clark, and then Ms. Powell, Mr. Robinson, Mr. Paul.
Okay. Good evening, everyone. I would like to first thank the ambassador and Dr. Tufton for this really good meeting, well put together, and also big up all the participants who found the time to participate as well. Now, first, to piggyback or to add to what Dr. Tufton, the question he answered about reinfection of COVID, I would just like to point out that yes, one can get reinfected with COVID because there's the issue of waning immunity, and so that is something that you know, one has to address, particularly those who have gotten their vaccines. Make sure that if you got 2 vaccines and you're a health worker or somebody on the front line, after about 6 to 8 months, if you're in that group that needs to get a booster, please get it. And having said that, the question that arises in my head just now about those vaccinated in Jamaica, particularly those healthcare workers, Dr. Tufton, who has gotten their vaccines early, both shots. Are there any plans in place for a booster for those people who are high risk and who are on the front lines? I understand that vaccines are a scarce commodity, but at the end of the day, what plans are you putting in place for the booster shots? And also, just to quickly, another quick question is, the 64,000 vaccines that became expired, was that from a lack of personnel or vaccination sites, or is that we got the vaccines late? And if so, if those are the reasons, what are you putting in place so that we don't have any more expired vaccines? Is it that we can add more sites and add more vaccinating personnel who can assist in the giving of these vaccinations? Thank you.
Thank you, Dr. Clark. Ms. Powell?
Good evening, everyone. And Minister Tufton almost said welcome to New York. I forget it's virtual. Anyway, I have to say, I must commend Minister for the work that has been done and continues to go on in Jamaica. I know it's quite challenging. And when we're ready, the diaspora has a way of, I would say, beating up on you. You know, we can really get out of hand, but we have to say that we are pleased. There are still some areas that we are concerned about, but we're not going to address those tonight. But I must highlight that the partnership, I'm very pleased as chair of the Jamaica Diaspora Northeast Health Sector, I'm very pleased for the partnership that is in place right now, especially the diaspora's response to the COVID crisis, and particularly this COVID-19 medical mission that will be on the ground as early as mid-October. I know earlier Dr. Rosemary Lewis said someone wanted to find out why take a team to Jamaica instead of sending supplies. I just want to add that the purpose of that mission is to relieve the burden. It's for human resources, but we are also getting supplies and equipment. As Consul General Mayor spoke earlier, I think all the regions are doing the same thing. We'll never forget these supplies and equipment. So if anyone is going on the mission and anyone is concerned, that we're just going with purses. It's not so. We will be helping with other, like supplies and equipment. I just want to add, as far as someone else brought up about the infrastructure, I'm going to do a brief appeal for the adopter clinic at this time. As far as the infrastructure, as we know, primary healthcare is the key before the pandemic and more so now. If the health centers are in good order, it would also relieve the burden on the hospitals. And so the Ministry of Health has an initiative. There are 320 clinics on the island, and they have identified 100 clinics to be adopted by the private sector and the diaspora. And so the Northeast has taken that on as one of our initiatives. And I'm happy to say that we have adopted 3 in the Northeast so far. We have Sandra Smith, who has adopted a Little London, and the New Testament Church of God in the Bronx, Reverend Peart is online. That was his second adoption recently. And we have an MOU that was recently signed by John Jay in New Jersey, adopting the Ulster Springs Health Center. And so it is very important for me. Yes, it's COVID, but everything is interlocking at this time, that we must help Jamaica in getting these primary healthcare centers in order, because now you see the hospitals are overflowing, and some persons who are currently at the hospitals don't belong there. They just need to go to their local health center. So we're going to put in the chat, you can reach out to us. If you want to get more information about the adoption clinic, reach out to us here in the Northeast, or any diaspora leader. They know how to reach me, because we got to get as many adopted as possible. Thank you.
Thank you, Ms. Paul, for that very passionate call out for support, and we appreciate all you and the team, all that you're doing in the Northeast for Jamaica. Let me go now to the last question from the event here, and that is Paul, Mr. Paul.
Hi. Can you hear me clear?
I'm hearing you, yes.
Great, my video is not showing, but I'm not a technical person. Is the minister still listening?
Minister is listening.
Excellent. So I want to revisit the question about the person that recovered from COVID. Minister, there seems to me that there's an opening here that could be filled. And what I'm referring to is there has been some tremendous studies done recently. One large one just came out of Israel that clearly demonstrated that persons that have recovered from COVID, their antibodies are superior to the vaccine. The Israeli study said up to 27 times more stronger than the vaccine antibodies. And that this was a huge study, just came out recently. And there's been other studies, I think as much as up to 15 studies which have demonstrated the same thing. But this is not anything new. We knew this from medicine for years ago. It's for some strange reason recently this was being questioned, but the studies have now put that to rest. And what this means or should mean in the future is the vaccine should really be targeted to persons who have not caught COVID. And that would be using resources in a wiser way. But if you are not reviewing the medical literature, or someone else in the ministry, they would not be aware of these studies. So what I'm saying, there seems to be
Okay, we got the point from Paul. They looking at some more recent studies on building up of immunity after having gotten the COVID. If you survive, and I see Dr. Clark already shaking his head, but we will come back to that discussion at another time. Let me just get the final question. Mr. Robinson, I acknowledged you earlier, and I see that you have your hand up. Just go ahead with the final question.
Thank you, Ambassador. I think I was the last one last time, and I appreciate it. And Dr. Tufton, you know, I'm both a fan of both of yours. I just have a quick question. Given the fact that people are so dug in their positions in this country here in the U.S., in Jamaica, and so forth, and if it's a fact that we got to get to herd immunity in order to get out of this virus, how do we undig people if they're so dug in? Are there any methods? I'd sure like to know, because I'm trying to find what the end game is here.
All right, well, we thank you all for your questions. We'll now have the final word from Dr. Tufton in terms of answering those questions and just giving a wrap up to us all.
Thank you very much, Madam Ambassador, and thanks to all who have sent in or spoken to the issues and advanced questions, recommendations, and otherwise. Let me just take these and then wrap up as asked by the Ambassador. First of all, Gary, I appreciate the appeal for Jamaicans to get involved and get involved in different ways, get involved in the ways that you best know how, your expertise. Public health is a very complicated portfolio. It involves people, it involves emotions, a lot of it. It involves expertise at the highest level. It involves egos. It's not easy to tell someone with 3 and 4 degrees that they are wrong and they should recalibrate or rethink a process. But ultimately, the benefits of it is that you provide a service that will always be appreciated. I mean, my greatest gift from what I do is not how much I earn. God knows I don't earn a lot from doing this. Is really when someone says thanks because you have saved their lives or you have given them some guidance that they otherwise would not have had, and so on and so forth. And Gary, is true that it's true that we have neglected our infrastructure over time. And the good news is that this government has been building back the infrastructure. We have an IDB project, 100 million US, looking at a major overhaul of Spanish Town Hospital, St. Anne's Bay, Maypen, 10 health centers either going to be built brand new or significantly renovated. We have Cornwall that has collapsed on us because of lack of maintenance, and Gary is involved in that, so we appreciate that. We have a number of other projects that are on the drawing board that will involve renewal of our infrastructure. The truth is we don't have enough people with the expertise, with the experience. And so we have to look externally for persons who are willing to assist. And our diaspora have people who can play a role. And he represents one of those, but there are several others. So we're always looking for that expertise. What we have to do is to accommodate and make them welcome and find ways to build and integrate the expertise, even from your remote location, but where you can visit. And so I'm more than willing and always willing to listen. So I thank him for that. The issue of the booster shots, you know, the recommendation of the WHO, and I agree with them, is that instead of talking booster shots now, we should try and make sure we have the world getting their first shot or first dosage. There's a large percentage of the world that are still yet to get the first shot. There are countries that are less than 2 and 3%. And of course, there are countries that are 60 and 70 and 80%. The problem with this virus is that if you don't address the entire world, no matter how much you think you are better off, you're still vulnerable. Because it's a world that is very interconnected. People travel. It's a small world. It has become a very small world because access to parts of the world is so easy. Not literally smaller, but access. And so variant strains emerge where vaccines are limited. And those very variant strains find their way into places that you never expect. And we all get impacted. And the worst thing that could happen is a variant strain that overcomes the power of the vaccine. And the way to avoid that is to ensure vaccines are everywhere. So I do believe that we need to spend the next 3 months, 6 months maybe, to focus on getting vaccines equitably distributed throughout the world. And I think in case of Jamaica, we depend on our diaspora support to get access. And I'm not suggesting free access, because we will buy. I mean, if we could get Pfizer vaccines right now to purchase, we would purchase it, because we need it, even though we are happy for the generosity of the US in donating and offering to donate. So I think the booster shots are not on the drawing board now for the healthcare workers. What we want is for all healthcare workers to get their first shot or first dose. Many have, but some have not, to be totally frank. And I know that's a universal problem. The expiration of the 64, it's not 64, it's just under 60, about 58. It's not a function so much of lack of communication or, we used up 240,000 of the 300,000. We would have loved to use the 300. We had a limited shelf life, 2 months as opposed to 6 to use this amount. And we have centers that have been empty sometimes. So it's a function of how do we get more people to buy into taking up the vaccines. The issues around adapter clinic. First of all, I want to thank that the comments around beating up on me. I don't mind that. I understand that it goes with the territory, and I take all the suggestions seriously. The adapter clinic program is a very important program, and it has been really bought into by the diaspora, and I really appreciate that. The intention of the program is to get Jamaicans who live abroad or Jamaicans who are here, who have experienced Jamaica, benefited from primary health care. This is a community health care now, where you walk from your home to the clinic to get your vaccination when you go into school, or get your toe dressed because you walk without shoes and buck your toe, to use a parochial term, or get counseling on your pregnancy and your baby, and that you're gonna, that's what primary health care is. Jamaica has a very strong primary health care system that has worked for us. In fact, it is what has helped us in this COVID response. Those public health nurses out in the field who visit homes, who look after the grandparents, who provide information to the kids, the pregnant mothers and all that. We have about 325 or so of them. And there are many of us in the diaspora who can relate when we lived in Jamaica to a community health center. And so this program is an attempt at saying, listen, join hands and hearts with them since you benefited from it, and help others to benefit from it. And let us adopt one of them. And the adoption is a term that we can all relate to. All it means is that you come in, you commit a certain amount of resources, whether in cash or kind. You get your recognition that you deserve for doing that. You can visit, but you help to upgrade, add up, chairs, it may be a paint job, it may be an air conditioning unit, it may be, sanitizing equipment, whatever it is to that health center to enhance the community work that's there. It's a 2 to 3 year commitment, and you can renew it. And we certainly would invite the diaspora, although many have really joined in on it, to look at it. And if you need further information, we can provide that information to you. But really a good initiative, I think. And we have had almost 40 adoptions to date. So it's really going well. And those who have adopted, I think, have gained a lot of satisfaction just knowing that they have contributed to helping at the primary healthcare level. The issue of recovery from COVID, what I'd say to that is, as I said, there are cases of persons who have had COVID having taken the vaccines. And I am happy to hear of this study in Israel that shows significant immunity being built up having had COVID. Remember now, this is a new virus, so studies are necessary. And Israel is one of those countries that have had a high rate of vaccination, perhaps higher than most for sure. and they were ahead of the curve in they vaccinated a majority of their population. Having said that, they have still had surges in positivity rates. What they have not had is hospitalization and deaths. That's because the vaccine has created a resistance to those who caught it after having had the vaccine. Further indication that the vaccine is really important. And we need to get people to take the vaccine and take the first one that they get access to. But the studies are important, so I don't disbelieve you. I've not seen the study. I'd love to see it because I would, we need to make a case too for the 80,000 Jamaicans and others that have not been tested who have had COVID. I think it will ultimately inch us closer to herd immunity, as long as we don't get variant strains that are so strong that they overcome the immunity that people have either from the vaccine or from having COVID. What I would say though is we should not allow this study to influence anyone to want to have the virus so they can have this immunity, because some of you may not recover from the virus. So I would still defend the need for the virus as a first line of defense and most effective line of defense, rather than to say, boy, if I get it, that means I'm going to build up the resistance. We don't want that. So we have to be careful how we send that message, even though I accept what you have said on the studies. And then the whole issue of herd immunity is something that is being challenged out there. But again, the studies will prove one way or the other. Again, the vaccines, to my mind, is what is going to be very important. So I close, Madam Ambassador, giving you have asked me to, having answered the questions, to say I really appreciate the interaction with the diaspora. I think it's necessary. I have the utmost respect and regard for the Jamaicans and friends of Jamaica who have done well, who have pursued their dreams and aspirations, who have, played an important role in the communities where they reside outside of Jamaica. Always very impressed, always very proud. Was in Washington last week, as Madam Ambassador knows, had a little gathering there of a number of persons, and everyone was at the highest level of their game. They were attended the best universities, had the most significant careers, making significant contribution. And as a country, small as we are, we punch far more heavier than our population and our size. And that's why we're exceptional. And I have the utmost regard for what we have done as a nation state, not just as a Jamaica physical location. What I think we need to aspire to is continue the dialogue, continue the networking, build the strength of the spirit of Jamaica. We're resilient people. I'm sure we're going to overcome this. I'm sure we're going to be better for it. This is our playbook to protect future generations. And part of that playbook is going to have to be how we work together, because this is not a one-man operation. It's not a one government operation. It is a all of us operation, whether we are abroad or here. And what we have to do on this side is to facilitate, to accommodate, to use technology, to use the various means to ensure that we protect each other, because we're family. Ultimately, that's what it boils down to. In the context of the world, every Jamaican is a family member, and we must view ourselves as that and find ways to protect each other, to support each other. And even when we have a little quarrel, it shouldn't be so bad that it makes us not want each of us to do well. So continue to shine, continue to strive, and we're continuing to be here for you and depend on you and to support you so that we pull through this particular challenge. Thank you very much. God bless.
Thank you, Minister, and thank you for your just very open and very warm embrace of the hardworking members of our diaspora, both those who have joined us here on the Zoom, those who have joined us on Facebook, and those who are generally just always supporting. And in that vein, let me again thank Representative Donna McLeod for turning up. I know you are so very supportive from over there in.
Ambassador, can I just say something? Thank you very much, and I'm so happy that we did this. Those of us that live in the U.S., we know the phenomena of denial. That you know, it's been, because I'm a chemical engineer, so for me this has been very strange. The reaction to a vaccine that is, you know, that people were waiting for, and now we're seeing rejection of the vaccine. It's very difficult trying to save people's lives, but we can't also forget the vaccines are important, but masking up is still a way to minimize the infection rate. My grandson is in school, and actually the kids are doing better than the adults that have shown up in our school board meetings screaming and yelling that their kids shouldn't wear even a mask. So I'm just asking everyone here to make sure that if you can get the vaccine, but masking up is still a way to, and it's a simple thing. It needs to be at least double or triple layers, but please mask up and take care of yourself. Jamaica is a very powerful island. Wherever we are noted for who we are, and people are usually in awe of us because we do so much. And since we're leaders in this world, we have to lead, and we have to continue leading and making sure that we get through this. And I think we will get through this, but it has to be where we take a conscious effort to take along other people with us on this journey to safety. Thank you.
Thank you so much, and thank you for your service over there in Georgia, and for always keeping Jamaica in mind, and for always shouting out wherever you can your support. It's appreciated.
Absolutely. Absolutely. I'm a yardie all day.
we were not, Congressman Evans still tied up in, as you know, a lot is going on in the Congress right now. So I'm glad you're able to come on and give some representation.
Yes.
I also want to thank Mr. Hector Rickes, Dr. Joyce Allen, Dr. Wayman Spence, all the leaders who have turned up here, and everyone who has turned up that have acknowledged already, to say it is always good to see you. And I appreciate you helping me to make the minister feel so welcome, and for us to have this great conversation. And I look forward to our continued conversation. Brett, I'm sorry I can't take any more questions. We try to go from 7 to 9 max. So please put your question, your comment or question in the chat, and we will make sure that we get back in touch with you. Have a good night, everyone, and all the very best, and thank you. Thanks again, Minister.
Booking your COVID-19 vaccination appointment is simple. Use one of two options. Option 1. Register using the online portal at the Ministry of Health and Wellness's website. Go to www.moh.gov.jm